Welcome back. Today is World IVF Day, and we have here with us Dr. Pooja Nadkarni Singh, a gynecologist and IVF specialist, in the last segment of this very special conclave that we are doing today. Doctor, tell us, why is it that we are talking more and more about infertility now as opposed to maybe 20 or 10 years ago? Is it because society is more open now and we are able to talk about it? Or is it really because infertility is more of a phenomenon in today's India? And is that because people are choosing to get married at, more advanced stages of their life now and choosing to plan a family later? Or is it because lifestyle factors? Could you tell us a little bit more on these lines?
So I've been practicing for the last 19 years now, and there has been a phenomenal shift in the way infertility is growing. I mean, initially it was around 10%, now it's almost around 18 to 20% of patients, people who are getting newly married are not able to conceive. And it's again more awareness. Of course, we don't know. 20 years back, it was a total taboo. Infertility was a taboo. A lot of people were not coming up with their problems to the doctor. People were not opting for IVF. It was a hush hush thing behind the doors. But now, with a lot of awareness, with a lot of people talking about it, a lot of celebrities coming out in the open talking about their IVF journeys, I think it has. That's also one of the reasons it's now in the limelight and everybody's talking about it. And it has definitely increased because of factors like late marriages, girls not choosing to get married till they're 35, chasing careers. People are want to be financially independent before they actually start families. Also, because of so normally a girl is required the ideal age to get pregnant is around in your 20s, early 20s, late 20s. So when you shift that to 30s, even if you plan at 35, the percentage of you getting pregnant is going to be much lower than you are 25. So that way it's going to rise. Also, there are a lot of lifestyle factors like a lot of social media. People are on the screens all the time. People don't sleep properly. Vaping, smoking, all these things play a big role. Lack of exercise, a lot of stress, mental stress has a big role on infertility. A lot of packaged foods, plastics, BPA. So this is epigenetics, like how the lifestyle factors affect your fertility. So all these are definitely coming in a big way.
Thank you, Doctor. Very instructive. However, you did mark lifestyle as a key, factor contributing to the rise in infertility, as have the other doctors that we have spoken to for this segment. However, it is also true that there are some things which are an inescapable part of modern day life. Like, we cannot escape, stress. Our lives are way more stressful than, for instance, our parents or grandparents were. Some of us, we have to, for instance, in the media industry or anywhere else, we have to work late nights. Some part of packaged food, when you're on tour or when you're in office, some part of it is a part of our life. So how would you advise people to maximize health? Because good health is equal to good fertility, up to a certain age. So how would you advise people to, while we have these things which are an inescapable part of modern lifestyle, how would you advise people to then get over that and then maximize their health?
So I feel that this should start at a very early stage. Like in your 20s, you are aware about fertility. You are aware that someday you're going to get married, have kids. And I feel that education is very important, awareness is very important. And it's not difficult. Like you said, it's definitely, we cannot escape these modern things. But I think doing things in moderation, knowing what you're eating it in moderation, like restricting these hours, trying to detox yourself a lot of times in between, taking a vacation, meditating, sleeping, working out. Like I'm a runner, I'm a marathon runner, so I run. So I think some hobby that takes you away from the phone and keeps you on the road, takes your heartbeat to that next level, sweats, you have sweating, and you're just out there. So I think that is very important. Doing everything in moderation is very important. Regular exercise, sleep, meditation, taking up a hobby, something other than what you're actually doing. Also, egg freezing. So everyone should be aware that there is an option of freezing your eggs. So if you say you're 28, you are not yet ready to get married, you don't have a partner, you don't want the pressure of, uh, getting married just to have a child naturally or something like that, you can always freeze your eggs. It's a simple process, 10-day process in which you can just freeze them, and then you can then plan after 10 years, you will conceive naturally. But if you don't, it's like an insurance, you can fall back upon. So I think those things are important to know that, and getting tested regularly. Yes. So AMH is a very important test for your ovarian reserve. Sperm counts are dropping. Last 15 to 20 years, there's been a great drop in the average sperm count of the male, maybe because of environmental factors, pollution, the air quality, whatever, the temperature, a lot of things, vaping, smoking, of course, alcohol, and all these fast food things. So I think regular checks on the sperm counts, on the egg counts, doing a simple sperm semen analysis or a blood test called the AMH can definitely keep you in the loop. You know that there's something, your AMH is low. You need to keep a watch on your ovarian reserve. You can get egg freezing done. You can get semen freezing done. Even married couples don't want to have a child for 7 8 years. They can freeze their embryos now very very safely, and through vitrification, there are babies coming up after 27 years in the US. So I think you have a lot of options now, and awareness, education, and being, knowing what is going on is very important.
Today we are in a world where obesity has become the norm. It is like a pandemic here, and we get a lot of these young girls who come to us, and especially if they are, they have this tendency to have polycystic ovarian syndrome, which later on goes on to develop diabetes and other problems in pregnancy. We do advise them to have exercise, which is somehow in this societal pressure of peer pressure, of educational pressure, they're all told to attend schools with all their classes and screen time. And most of the mothers said, whatever she eats, I mean, she hardly eats, first of all. That's always a problem with the mothers. And she doesn't have time to exercise. I mean, that cannot be the answer. We do tell them that exercise is the way forward. And because if it starts then, only then it will go on to let them have a healthy lifestyle in pregnancy and menopause and beyond.
From a country that is one that loves to watch sports, that is a fan of sports, has now started living it. People, elite sports is basically a few people performing for many. But now that whole cultural shift has happened where it's not just about becoming a top athlete. It's not just about with the dream of becoming a professional player, but people realize, and parents realize, and kids somewhere realize that sports is solving two very big modern world problems, which is health and loneliness. As you come together as a community in sports which are easy to play, which are accessible, don't require massive arenas, don't require massive infrastructure, you will automatically see a big boom in that. Whether it's marathon running, whether it's cycling, or an indoor sport which requires a table, like chess.
That was two very eminent doctors, Dr. Pooja Nadkarni Singh and Dr. Sita Ramurthy Pal, along with Tania Sachdev, chess champion, Arjuna awardee and grandmaster, speaking to us about aspects of fertility health, mental health, women's health, and overall health and wellness. And each one of them has advocated physical activity and taking up sport as a part of your daily life. And you must be wondering why we, Revsportz, as a platform that covers sport, is doing this kind of an awareness program. That's because Revsportz, as a platform that works with sports and sports persons, is not only dedicated to bringing you coverage of sports and sports tournaments from across the world, we are also passionately dedicated to spreading awareness on physical health, physical literacy, mental health, women's health, and overall health and awareness. So today, this awareness program has been for World IVF Day. If you have watched and enjoyed each of these segments, do spread the word amongst your friends, family, neighbors, and even your children. And finally, thank you very much for watching.